Ibovan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando and this is your weekly dose of wellness here on Healthline. Today we are going to be talking about a very sensitive topic, especially to married couples. When you're married, bringing a new life into this world is something that everyone looks forward to. But in some cases, it may be more difficult than the others. So today we are going to be talking about the topic of subfertility. To talk about this topic, I have invited Dr. Suranga Hettipathirana. He is a consultant gynecologist and an obstetrician, and on a personal note, he is one of my gurus as well. So it's indeed a great pleasure and privilege to welcome him to our Healthline studios. Very good evening to you, sir, and thank you for joining us.
Yeah, thank you. Thank you, Dilshan. Thank you for inviting me to your Healthline segment. I think selecting the timely topic of subfertility, which is an upcoming problem, and which is though it's not a disease like we know we are more in looking for these cancers and other diseases. But when it comes to subfertility, it is not a disease, but what we do see is because of that there are a lot of problems. Lot of people, like the people, these couples, they are suffering a lot. So there are silent sufferers. So I think most of the time it is because of lack of awareness. So I think we will discuss and we can enlighten them on what is and what to do and how to come out of this problem.
Definitely, yes. It is a very important topic to be aware about, because most of us, we don't know what these facts are, what these predisposing conditions towards subfertility. So as we get into the topic, sir, now people have an idea of what subfertility is, but sometimes it's not really subfertility. So if you can talk about the definition, what is subfertility really?
Yes, Dilshan, is very important. So in books, what they do say is subfertility is defined as when a couple, like, because now all the couples, like soon after marriage, they are not planning for a pregnancy. So it's not the number of years, how many after marriage, how long it is actually how long they are trying for. So what they do say is after marriage, when they are planning for a pregnancy and consecutively for 1 year, if after having regular sexual intercourse. So what they mean by regular is at least 2 to 3 times per week, and if they are not using any other medications such as contraceptive pills or any other thing, and if they are not conceiving after 1 year, yes, we take it as subfertility. So as you mentioned, the important is the years, like, because what we have to understand is now, because of the social pressure, which is very bad in Sri Lanka, soon after marriage, after few months, everyone was asking, okay, are you all, like, when you are planning, or aren't you not yet conceived, like, so, which is very bad. So but what we have to understand is it is 1 year, but when we are considering this year, it is not always 1 year, but take into consideration, like, if a mother is, like, the female's age is more than 35, and if she is having other problems like period problems where they are not regular, they are happening every 2 monthly or every 4 monthly, and the periods are quite heavy and they are quite painful. So which means there might be some underlying cause, in which case we do say not to wait for 1 year, like to try to see whether there is to see the problem after about 6 months.
So even though we say 1 year of regular sexual intercourse after getting married, it may vary on your individual conditions. So it is always very pertinent that you get followed up by a properly qualified obstetrician to get your issues sorted out. Now, talking about subfertility, I said it's quite a common problem, but if we really talk about numbers and how Sri Lanka will compare to the Western world, what is the situation now in our country?
Yes, if we take statistically, the prevalence of subfertility is about 10%. That is what the world standards, worldwide statistics, that's what they do say. So when we apply it into Sri Lanka, actually we don't have good studies done to see what is the prevalence in Sri Lanka, but it is more or less in that range. There are some small studies done. They say it is in the range of 10 to 15%. So which means out of 10 families, like 10 couples, 1 or 2 might end up with some issues with the fertility. So it is more or less similar to what is happening all around the world.
But if you compare over the past couple of years, has the prevalence increased, or is it remaining the same?
Yes, practically what we have seen, it is increasing, like due to so many factors. So, like from the studies they have done, like if you take few factors which is affecting fertility. So, what they have found out, like globally, not only in Sri Lanka, everywhere, the sperm counts in males, they have seen over the last few decades they are coming down. So, what they do attribute it is due to the environmental pollution. So, because there are a lot of toxic fumes and everything, so which we inhale. So, day by day everyone, when we are exposed to that, the quality of the sperms are going to get down. Like, so they have found that it is coming down. So, obviously it is going to affect the subfertility, so like fertility. And on the other hand, there are some other factors, like if you take another one like pertinent to in Sri Lanka, like if we take 1 or 2 generations before, like our grandparents, at their time, like they normally marry at quite a young age. By the time they are 20s, they are married, and by their around they are 25, 26, they are having 1 or 2 kids. But with the development of the countries, and I am not saying which is bad, like for example, the females, now they are studying. So, they are doing degrees and postgraduate, and they are going to jobs, and their professional targets are there. So, when they are going to achieve those things, what do happen? When they are marrying and when they are planning for pregnancy, they are in the range of age of 30, 35. So, which we will discuss in few like down the line. So, that also affects the fertility, because age is a very like pertinent factor which when it comes to fertility. So, likewise there are so many factors, other factors, like there are so many factors which affects fertility, and we have seen like because of that subfertility incidence is getting higher and higher.
So, that is one reason why I thought that we should discuss about this topic today. And one interesting fact that Dr. Suranga mentioned, with the environmental pollution going around, the sperm count in males are coming down, because in the Sri Lankan setup we see the pressure is almost always on the female. When there is a issue in the fertility, everyone tries to focus on the female, but there are male factors and female factors. Having said that, my next question to you, sir, is now when we talk about subfertility, what are the factors in a female that would contribute?
Okay. So, Dilshan, like, so you brought up important fact which is very important, particularly in Sri Lanka, because of the way we are looking at these subfertility. So, when we talk about the factors for fertility, like subfertility, 50% is due to female factors. And what we should not forget is 40%, 30 to 40% is due to male factors, which we will discuss. So, as your question, and then around 10% it is due to, because both of them, both of like male and female, they are having some problem together. So, as we are discussing on the female factors, like the commonest cause for female factor is problem with ovulation, where the mature egg is coming out. So, in most of them, like what do happen, it is not happening. So, how clinical, like how the patient has to think about, okay, whether I might having that problem is by looking at their period cycle, like how regular they are. Normally, if a female is getting like regular cycles spot on 28, 30 days, okay, most probably her ovulation is happening. But if it is not, like if it is going beyond 35 days, or sometimes it happening every 2 weekly or something like that, like which means there might be some problem with her ovulation. So, out of the factors, the commonest factor is the problem with ovulation. Then one of the important factors which we discussed initially, also the age. Age plays a significant role when it comes to fertility. So, if we take like out of this age which we are talking about, the female age, in her, like, so the ideal age to get pregnancy, what they do say is around the age of 25, 30. But I said, like in the current context, what do happen, because of, like as we discussed earlier, because they are having other professional goals. I am not saying that not to study, like stop everything and to have kids, but it is not that, but you have to balance it out.
Yes.
Okay. Because what we do see is like if we take age after 35, like after 30 it starts dropping, after 35 it increases, and after 40 it is very, very difficult to get pregnant, because by that time, why we say age matters very much is because if you like if we take now we know the in females what we do get is eggs, that number of eggs that in a female is there right at the birth, the whole eggs which is going to be there for the whole rest of her life, as opposed in the male every 3 monthly we are producing new eggs. So, in a female, so when the age goes, the number of eggs goes down, number one. Number two, as with time, because of this pollution, what we do eat and everything, these eggs get exposed to so many toxins. So, there would be so many defects in these eggs by the time you are getting old. So, age plays a great part in subfertility. So, age is also another factor. The other things are just these female problems like this, what we call endometriosis. So, where like in late term we say this blood cyst. So, when they do get these sort of conditions, so then there is something called adenomyosis, fibroids, and any pelvic surgeries have done, they do affect also the fertility. So, those are the other factors, but the key things are the anovulation and the age.
Now, when talking about AIDS, let's talk about the male counterpart also. Does age play a role in the males as well?
In male, no. Because what I said is, now in male what do happen is, in the male system the sperms are produced like new set of sperms are produced every 3 monthly. So, like and there is no end point for it, like at the age of 60, 70, like now we know in females we do say that they go into menopause at the age of around age of 50, 55, like what we are mentioning menopause is, they like by that time all the eggs have gone, so they do not have any more eggs, that is why they can't have kids after that. But as suppose in males age of 60, 70, 80, like still they are having the potential of producing sperms. So, with regard to fertility, there is no major problem with male age, but there are some other factors like some other like genetic disorders, and they can come into play when the male like the male's age is also going up, but that is not a very big problem. So, the age factor is mainly for the female.
Mainly for the female. And now, since we spoke about the factors in a female, it would be good to focus on what will affect the fertility in a male as well.
Yeah. In males, the main factor is the sperm count. So, in the sperm count there are so many parameters, like basic like parameters we are looking at it, but if we take on some basic parameters, we are taking about the count of the like number of like spermatozoa we do see, like when we are checking for the sperm test, that is what we do say, we see how many number of sperms are there. So, we are looking at the number of sperms, and like I think you might have seen that the sperm is always motile, like it moves forward.
Yes.
So, how many them of are moving forward. And in a sperm there are 3 components mainly: head, neck, body, and then rather than 3, 4 and the tail. So, like to be a good take as a good sperm, all these components has to be there, so which we call morphology. So, that has to be good. So, likewise there are so many parameters we are looking at. So, in a male mainly these parameters go up and down. So, for which there are so many factors are playing. So, here it comes as we discussed earlier, the environmental pollution. So, if you are like in like that you can't, like we actually personally we can't do that because we have to live in this environment.
Yes.
But things what we have to think about is the other things, like for example smoking. Smoking is like, because there are a lot of toxic things in these fumes like what we inhale, so they can affect the quality of the sperms. And alcohol is to a certain aspect it affects, but rather than alcohol, main thing is the smoking. So, we have to be very like, so the males who are having fertility issues, I think alcohol and smoking has to they should stop it, rather than cutting it down, they should stop it. So, in a male the main factor affecting the fertility is the sperm parameters. On the other hand, the others are the coital issues and some anatomical problems in the penis. So, which like I think they are all medical jargon, like there are some anatomical, like so with the development problem. So, in those sort of things, like there are some difficulties, and other one is erectile issues. So, which is not very common in Sri Lanka, but most of the time these erectile issues are due to psychological factors. So, that is why it is important, like this, like when you do have a problem, always try to seek medical advice. Because most of the time what we do is we go and Google and we see, or we ask from the friends, and so we might get the wrong information. So, like we have seen a lot of people who are having erectile problems, but actually it is psychological rather than actually they are having a problem. So, like just counseling and some interventions would help them. So, in male there are not major lot of factors in, like when it comes to factors wise, but still 40% of subfertility like causes for subfertility are male factor causes. So, that is why it is very important. We will come, I think we are discussing about the investigations which we are going to do. When we are going to look into these problems, always we have to have the male partner as well, which is a very thing which we find it very difficult to bring it down, like when it comes to treating these couples.
Definitely. Now, as I said before, all focus will be on a female when there are fertility issues, but like Dr. Suranga said, 40% of it accounts for male factors. Now, when a couple has fertility issues and they've been trying for like you said 1 year and they couldn't conceive, and when they come to you, how would you approach this couple? What kind of information would you gather and what kind of investigations would you do just to see what the problem is?
Yeah. In most of the couples, I think in my approach what we do actually see is whether they do, as like when we at the beginning as we discussed, whether they are actually having subfertility. Because we have not done studies, but it has shown stress itself involves in the great extent into the subfertility. Why I am saying so is because we have seen couples, as we said earlier, soon after coming, like marrying, after 2 to 3 months, there is a peer pressure. So, every time when they are going to like have sexual intercourse, like they are thinking about this fertile period and this is the best day, and they go on this, there are apps and saying these are the best day, and they are, so every time when they are doing, they are focusing on that one, and so like it is a stress. So, we do not have studies as such, but it has shown stress itself is a major part. So, my one message is always like in fertility, when you are planning for a pregnancy, one thing is what you should develop is patience. Do not rush, wait, give adequate time. Like for in joking sense, like what they do say is like, now if we do see this single thrill dramas or the Hindi films, like in that one, the moment you have sexual intercourse once, you get pregnant.
Yes.
So, it is not like that. So, statistically what they do say is in the like why we say 1 year is because what they have found out, say a female is there, a male is there, both of them are having no problems, nothing, medically everything is okay, they are having sexual intercourse every day, but in the first month only 30% would get pregnant. And if we do it for 1 year, 80% of them would get pregnant. So, which means like majority would get pregnant, nearly 80% would get pregnant after 1 year, but not only within the first month. Okay. So, time, that is one thing. So, always see whether they are having this problem actually. So, what we sometimes what we have to do is just counsel and then send, like if you clearly explain them, most of them they would understand, and we would see that there are good results. Okay. Then when we are approaching, when we are trying to investigate, like it is bit like what investigations wise, when we are going, like if we take in the female, the basic investigation we do is ultrasound scan. Okay, so it might be most of the time from the vaginal scan. So, basically we are looking at whether they are having any problems in the womb, like fibroids, and by medical terms there is a condition by the name adenomyosis, and whether they are having any ovarian cyst, and whether there is any evidence of endometriosis. So, those are the things normally we are looking for. So, the very basic investigation is the ultrasound scan. And in addition to that, there are a lot of other blood tests which we are doing. So, which all depends on presence of other features, like when we inquire from them if they do not have irregular periods and the periods are painful and so on and so forth, then we might have to go on for some blood test. So, there are a whole array of blood tests. One basic one always we do is the thyroid profile, because we do see like lot of people do have thyroid problems, subclinical, and which affects fertility in a great way. So, basically those are some basic tests which we do. In addition to that, like what I am saying, that all the couples when they do come, we are not going to do all these tests. Yes. But if we, after treating for some time, if we do see that she is not getting pregnant, what we have to see is whether there is any other problem involved in the tubes, whether they have been blocked or whether there are some problems with her ovulation. In which case, when we want to go for advanced testing, we go for surgery by the name laparoscopy, the keyhole surgery. Normally, like commonly, you all like people might have heard about laparoscopy and dye test. So, which we do that. So, in which case, like when we do that one, we can see everything, the womb and the tubes, ovaries, and if there are any adhesions, and at the same time we can put a dye from below and we can see that whether the tubes are blocked or not. So, we would go for those things. And the same way, like to check for the tubes, there is another test by the name Hysterosalphinography, like which is a basically an X-ray we take to see whether the tubes are blocked. So, these are some of the basic tests which we are doing, but like after treating for so many years, like if they are not getting pregnant, there are so many other tests to be done, but these are some of the basic tests which we do out on a female. And in a male, if we take the basic one, we do is the sperm count, so sperm analysis. So, we ask them to produce a semen sample and then we take it and we in the lab they would check for these parameters which we discussed earlier, the number, the motility and the morphology. So, in a male tests are limited, like if the female, if the sperm counts are normal, we take that the male is otherwise normal, like if they are erection, that there is no coital problems, but in the female there are a fair number of investigations. It all depends on individual factors. Yeah.
So, after doing these investigations, now you said there may be problems in ovulation, there may be other problems in the anatomy of the female, or there may be a problem in the male as well. So, once we figure out what exactly is wrong, what is your approach to treatment? How can we correct this situation?
Yeah, Dilshan, like I will simplify. So,
Yes.
what I will do is, rather than, because like when it comes to how we are going to treat, like it all depends on individual patient. Like, so after going through the history, because the subfertility is very, like it's bit complicated, like the history and the test and everything, then after finding the cause only we are thinking, okay, which one is best for this individual couple. But if I just list out the treatment options we are having, okay. So, when it comes to treatment, always it is not medication. So, there are some lifestyle modifications which we have to think about when we are talking to, when we are, like it is not only for subfertile couples, for any general couple who is planning for pregnancy, these are good things we should do, rather than we should do. One is body weight. So, what we have found out, the body weight plays a key role, like in a major way with regard to fertility, and even not rather than fertility, even after getting pregnant, throughout the pregnancy also it plays a major role. So, because of that, always try to maintain the ideal BMI less than 25. Okay. So, if you are obese, like cut down on what you are eating, like carbs and the lipids, and then do good exercises. That is one thing. And as I discussed earlier, smoking, which is like we do things, like I am not saying that it's a taboo, you should not do whatever it is, what I am saying, but when you are planning, at least, because smoking, like we know, like fair number of females are smoking in Sri Lanka. So, think about it and stop it, because it plays, like it have a major impact on fertility. Though it has not proven with studies, there might be, like if I am wrong, but it is a major factor. That is lifestyle modification. So, good exercise, diet, cut down on the weight, have ideal body weight, and on this smoking and alcohol. Then when it comes to managing, like most of the time, because I said the majority of time it is because the anovulation problem in the female. So, there are so many medications. So, it might be tablets, and there are injections which we go as a second line if the tablets won't work, where we give it to the female to push and to make sure that they are going to ovulate them. Okay. So, that is one basic treatment approach which we are going to do, and if the sperm parameters are normal, we say okay, just have regular sexual intercourse. With that, we do see majority of them would get pregnant. But in case, like if there is a problem in the sperm parameters, like their like counts are not that good, brilliant, or else after treating with just with all the medication which we said that the female, and but still she is not getting pregnant, as the next option what we go is for what we call IUI. So, IUI stands for intrauterine insemination. So, basically what we do is we take a sperm sample, and out of that sperm sample there are different techniques. We pick up the best sperms, good sperms, and then we concentrate it, and via a tube we put them into the womb through a tube. So, that is because it has shown, like in a subfertile couple, it increases the fertility rate. Yes. So, that is the next one. So, it is like in this IUI, it does not involve any anesthesia, like we take it as a general, like a clinic procedure, where when they come, we in the lab they prepare the sperm sample and then we put it, that is IUI. Then what you have to understand is most of the subfertile couples after these two treatment options, the medication, oral medication to the female and with couple with IUI, majority of them would get pregnant. So, out of we say out of the whole population 10% of them are subfertile. So, out of those also majority would get pregnant with these two interventions. But if this fails, only we have to think about the next option, which is actually in vitro fertilization or what we call as IVF. Okay. So, IVF is little bit complicated and it involves cost, because in Sri Lankan setup still in the government sector we are not offering it in a free pay basis, but they are planning, they are building up a new unit in Colombo and they are trying to like I think in future they might bring it up and they might offer it in a limited basis, but at the moment so far it is only in the private sector. So, the IVF involves like where we try to take maximum number of eggs from the mother, like the female partner, by giving injections, and then in the lab setup we fertilized and make the embryo, and then at the proper time we put it in back to the womb. So, like here if I do mention, now I said that like now terminology wise we like the people who are not getting pregnant we call subfertile. Those days we said infertile, which means that they are not like, but rather than that now why we have changed it to subfertile is because with the development of the IVF, there are in the IVF also there are so many other new interventions. For example, we have a technique by the name ICSI. What it says, intracytoplasmic sperm injection. So, where what we can do is we can take one sperm and inject it straight into the egg and make it to fertilized. So, like if the male factor in the male partner the sperm numbers are quite low, we can do that one. Likewise, there are so many new interventions. So, IVF have changed this whole subfertility problem in a great way, like where we can make them most of them pregnant. And even when it comes to like mothers who are the females who are more than the age of 40, like where their eggs are very low, like the count wise, we can go for donor egg programs. We can take a donor egg from another female and we can make a baby for them and we can put it back. And like the same way, like with this new development, like if there are like sperm problems, we said that we can go for this XC. And if there is a like a problem in the womb, we can go for programs by the name what we call surrogacy, where we make the embryos and we deposit it in another female's womb, and they can then the couple can have the baby. So, there are some legal issues with that, we have to sort it out, but like there are so many approaches now with this development, with the latest development in 21st century, we do have a lot of things. So, when it comes to treatment, there are so many options. So, that is the key thing what they have to understand is, because like when you are trying, if you are not getting pregnant, that is why it is important, as you said mentioned earlier, to go and seek medical advice, because there are like in Sri Lanka we have more like most of this or almost all which is available in the world we are having in Sri Lanka. This IUI, sperm freezing, IVF processes, ICSI, donor egg programs, everything we do have. So, it is basically what you need is the proper advice and the guidance.
So, that is exactly why I wanted to bring this program to you, so that all couples who are suffering from this silently, you should know that there are so many options available for you, but like Dr. Suranga said, it can't be generic, it can't be general for everyone. So, our message to you is, if you are having a problem, always go to a properly qualified obstetrician and get their guidance, so that if one method does not work, we can always escalate to the next, and by doing that your chances of getting pregnant are quite high. And even though we touched, this is a very vast area of discussion, and even though we touched quite superficially, I think our message to you is quite clear. So, with the time constraints that we have, we are coming towards the end of this program, but before we wind up, what would be your message to our viewers, because we know it's a real problem, it's something that people suffer with silently. There's a lot of social pressure peer pressure. Everyone is looking at a newly married couple, expecting a new life. So, before we wind up, what's your message to our viewers?
Yeah. Number one is, which I try to highlight in this whole throughout the program, is age. So, I am not discouraging females to say and not to go for their professional development, like professional goals. What I am doing, say, like always, you have to discuss with your partner and try to balance out things. So, do not delay the pregnancies for too long. At least by the age of 30, 35, before 35, try to plan for you at least your first pregnancy, because after 35 there can be problem. So, number one is age. The second one is, if you are having a problem, when you are going to seek medical advice, always go as a couple, because 40% it is due to male factor. Because Sri Lanka, like our society is like developed in such a way, it is a male dominant society. So, always like the problem is when there is a subfertile couple, they look at thinking that it is due to this female. So, she is the culprit, she is the culprit. So, and the males, they do not want to, it is nothing like just the sperm count is abnormal, that does not mean that you are not a male, it is just some like problem in the development.
Yes.
So, because of that we are finding very difficult to bring them down to get these investigations done. So, always both of you has to go, otherwise there is no point just treating the female. Number 3, I think which we did not discuss, like it is, I am not saying that we are practicing Western medicine, but what I am not trying to say that everything in Western medicine is correct, that is the only thing. What I am trying to say, because we do see a lot of people like they go on shopping because when it comes to treatment option, there is Western medicine, there is Ayurvedic, there is homeopathy, likewise there are a lot of so what they do is they go from one to other, and ultimately when they come to us it is bit late. So, what I am doing, say like anything, like even in Western medicine, if you are coming to get treatment from us, and if you are after treating for 1 or 2 years, if you do think that it is not working, okay, go for something else. But same way it should apply other way around. Like when you go for, I am not saying, I am not putting down Ayurveda, because that is what is happening in Sri Lanka for a long time. But if you are going on something and if you do think that you are not getting any success, try to look for other avenues, like to try to see and come at least, because we do see, like as I said, by the time they do come for us, it is very late, and when it comes to IVF also, by that time it is too late to do it.
So, that is very, very valuable advice coming from Dr. Suranga Hettipathirana. If you are having some issues, do not try to always suffer in silence, seek the advice of a properly qualified medical practitioner, and that is why we bring these sort of programs to you, so that you are very well aware of what the options available to you are. Having said that, it is time for me to wind up. I thank Dr. Suranga very much. Thank you, sir, for joining us and enlightening our viewers, and because that will, this topic is about bringing a new life into this world, which is a very precious and very highly anticipated thing in a married couple. So, I thank you once again, sir. Thank you very much.
Thank you, Dilshan. Yeah, thank you.
So, it is time for me to wind up from this edition of Healthline, and until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Ayubowan.